All right, we're going to look at the muscles that are responsible for the motion elbow flexion, or the muscles that create an elbow flexor torque. So flexion occurs in the sagittal plane. Let's get that plane in there, and about the medial lateral axis. All right. Based on line of pull, the muscles that are on the anterior side of the elbow joint create the elbow flexor torque because they're anterior. And so when the muscles shorten, you have a flexion motion at the elbow joint. So let's take a look at that motion. So here we see the angle becomes acute, and we have quite a few muscles responsible. We have the biceps brachii, the brachialis, and then down here, the brachioradialis. And so here we're getting rid of the biceps brachii. And I just wanted to highlight, when you get rid of the biceps brachii, then you see the brachialis, which they consider the workhorse of elbow flexion. The brachioradialis works more when you are in a neutral posture of your radial-ulnar joint. And if you go from a supinated position to a mid-pronated position, you'll see that brachioradialis muscle kind of pop up from your forearm. All right, so getting into the muscles a bit more, one thing, the innervation of these elbow joint flexors and extensors are fairly easy to remember. Anterior arm muscles are innervated by the musculocutaneous nerve, and the posterior arm muscles are innervated by the radial nerve. So let's look at these muscles on the anterior side, which create the elbow flexor torque. The most famous is the biceps brachii. The biceps brachii should not be famous as being a bicep curl muscle, but that it is a three-joint muscle, right? We've talked about two-joint muscles, but now we have a muscle that crosses the glenohumeral joint, the elbow joint, and the radial ulnar joint. It has two muscle bellies. The short head comes off the coracoid process of the scapula, so that crosses the glenohumeral joint, and the long head also crosses the glenohumeral joint, going up to the supraglenoid tubercle of the scapula. And then they attach in the tuberosity of the radius. Since it's attached on the radius, it is also a supinator. So when your radial ulnar joint is in pronation, the biceps brachii can help to supinate that joint. So it flexes the glenohumeral joint since it's anterior to that joint. It flexes the elbow joint since it's anterior to that joint. And then if you place your hand over your biceps brachii muscle belly and pronate and supinate your radial ulnar joint, you can feel that biceps brachii kind of turn quote unquote on and off. So you can feel it when you're in supination and not so much when you are in pronation. We also have the brachialis, which we saw, which is deep to the biceps brachii. It is a one joint muscle, so its only function is to flex the elbow or create an elbow flexor torque. Remember, muscles create that internal torque. Then we have the brachioradialis, which is also an elbow flexor torque creator muscle. The muscle belly is located in the forearm, so it doesn't have the greatest line of pull. It goes from the lateral epicondyle of the humerus to the styloid process of the radius. Just note, this is the only anterior arm muscle that is innervated by the radial nerve. And that's just how it migrated from kind of evolutionarily. I did want to remind everybody of the coracobrachialis, even though it does not act at the elbow joint, just remember it because it's a forgotten muscle. So it's a small muscle medial to the biceps brachii, attaching to the coracoid process, and it is a glenohumeral joint flexor and also helps with a deduction of the glenohumeral joint. Okay, we'll look at a different slide views of these muscles. So this is all the muscles together. So we can see our biceps brachii, long head and short head. And then down in the forearm, you can see your brachioradialis. So again, biceps brachii, you can see it going up through the bicipital groove to the supraglenoid tubercle, and then the short head going to the coracoid process. And then both heads attaching on the radius, which allows it to be a supinator muscle. It's also an elbow flexor and a flexor of the GH joint. Brachialis, just a hard worker, comes off mid shaft of the humerus, goes to the ulna, so does not do anything with supination, right? Because remember, in pronation and supination, the ulna does not move. So its function, since it's anterior to the elbow joint, is just to create an elbow flexor torque. And then we have the brachioradialis, which the majority of the muscle belly is in the forearm. So it's not really set up to be a great rotator or a flexor of the elbow joint. But it is anterior to the elbow joint, so it does help with flexion. It has other functions just from where it is. And remember, it's innervated by the radial nerve, but it pronates the radial ulnar joint back from supinated position, and it supinates the radial ulnar joint back from a pronated position to neutral. So just to that neutral position.